Human history has witnessed terrifying pandemics, where viruses and bacteria became invisible but brutal enemies, completely changing the world. From the Spanish flu that claimed tens of millions of lives in a few years, to HIV/AIDS that lasted for decades, or COVID-19 that paralyzed the world, each pandemic has left an indelible mark. These disasters are not only painful losses but also valuable lessons, reminding us of the power of science, solidarity, and the importance of preparedness in the fight to protect life. So what helped humanity overcome those dark times? And what have we learned from these pandemics? 1. The Justinian Plague, 541 to 542. The catastrophe that shook history. In the 6th century, the Justinian Plague broke out, becoming one of the greatest disasters in human history. The pandemic not only claimed tens of millions of lives, but also changed the economic, social, and political landscape of the Byzantine Empire, and had a profound impact on the ancient world. First appearing in the Egyptian port of Pelusium in 541, the pandemic quickly spread to Constantinople and other regions through the bustling trade routes connecting Europe, Asia, and Africa. The constant movement of merchants, soldiers, and residents made the disease an uncontrollable nightmare, especially in densely populated cities. The cause of the pandemic was identified as the bacterium Yersinia pestis, spread by rats and fleas. Rats living in grain silos, houses, and ships became vectors for the disease. With poor sanitation and overcrowding, the disease spread rapidly. In Constantinople, the capital of the Byzantine Empire, the disease spread unchecked. Thousands died every day from terrifying symptoms such as high fever, body aches, and large lymph nodes in the armpits, neck, or groin. Those infected often died within days, causing widespread panic. Unburied bodies piled up in the streets, increasing the risk of further spread. At its peak, the death toll in Constantinople was estimated to be as high as 5,000 people per day. In total, the pandemic claimed an estimated 25 to 50 million lives, equivalent to 40 to 60% of the European population at the time. The plague spread beyond Constantinople to Italy, Spain, North Africa, and the Middle East, devastating the economies, societies, and cultures of these regions. The sharp decline in population caused agriculture to fall into crisis, causing prolonged famine. The shortage of labor and stagnant trade significantly weakened the Byzantine economy. As a result, the Byzantine Empire could not maintain its power in distant territories, creating opportunities for other peoples, such as the Arabs, to expand their influence. The pandemic not only left serious human consequences, but also changed the political history of the world. The weakened army, stagnant economy, and chaos among the people caused the Byzantine Empire to lose its position as a great power, directly affecting the balance of power in Europe and the Middle East. This was also one of the reasons contributing to the decline of this empire in the following centuries. The Justinian plague was not only a disaster, but also a painful reminder of the vulnerability of humanity to nature and disease. The ignorance and lack of disease control measures at that time made the disaster inevitable. Although science and medicine were not yet developed to combat the disease, the lessons learned from this tragedy are still valuable today. The importance of hygiene, public health control, and disease management has been emphasized more than ever. The Justinian plague is one of the historical events that reminded humanity of the destructive power of nature when humans are negligent and unprepared. Even though centuries have passed, the story of this disaster is still mentioned as an important milestone in history, where humanity learned to face and overcome unforeseen dangers. 2. The Black Death, 1347 to 1351. The most catastrophic pandemic in European history. The Black Death was one of the most devastating pandemics in human history, breaking out in the 14th century and claiming the lives of tens of millions of people. Originating in Central Asia, where the bacterium Yersinia pestis existed in rat populations, the disease quickly spread thanks to the trade routes connecting Asia, the Middle East, and Europe. In 1347, merchant ships from the Black Sea brought infected rats to Italy, from where the pandemic spread throughout Europe. Poor sanitation and high population density in large cities caused the disease to spiral out of control. The Black Death was caused by the bacterium Yersinia pestis, manifesting in three main forms: lymphoid, pulmonary, and septicemic. Typical symptoms included high fever, body aches, and large black lymph nodes in the armpits, neck, or groin, signs that gave the pandemic its name. Deaths often occurred within days, causing the rate of spread and mortality to skyrocket. It is estimated that between 1347 and 1351, an estimated 75 to 200 million people died, accounting for 30 to 50% of Europe's population. Many villages and cities were completely wiped out, leaving behind horrific scenes of corpses piled up in the streets, churches, and mass graves. The pandemic not only caused a humanitarian disaster, but also profoundly changed the social and economic structure of Europe. The sharp decline in population led to a shortage of labor, causing agricultural production and trade to stagnate. However, this also brought opportunities for the survivors, as they could demand higher wages and better working conditions. The feudal system weakened, and a middle class gradually emerged, profoundly changing society. In terms of religion, the Black Death shook people's faith in the Church. Many believed it was a punishment from God, while others blamed minorities such as the Jews, leading to bloody persecutions. Some extremist groups, such as the Flagellants, self-mortified themselves to atone for their sins, reflecting the chaos in religious thought during this period. The failure of the Church to contain the pandemic also paved the way for major reform movements that followed. Measures to deal with the pandemic, such as lockdowns, quarantines, and mass burials, only partially reduced the spread. Ignorance of the cause and transmission of the disease made any efforts to control it futile. However, the Black Death laid the foundation for later advances in public health management and epidemiological research. The Black Death was not only a medical disaster, but also a major turning point in human history, completely changing the economic, social, and religious structures of Europe. The pandemic paved the way for the Renaissance that followed, emphasizing the importance of science, hygiene, and medicine in preserving life. Centuries later, the Black Death remains a reminder of humanity's vulnerability to nature and its resilience to overcome adversity. 3. Smallpox pandemic, 16th–20th centuries. The longest war against a pandemic. Smallpox, one of the most devastating pandemics in human history, raged for centuries, from the 16th to the 20th centuries, claiming millions of lives. With its high mortality rate and severe consequences, smallpox was not only a medical disaster, but also left a deep mark on world history. The variola virus that causes the disease is believed to have appeared more than 3,000 years ago, with evidence found on ancient Egyptian mummies. However, the pandemic really broke out strongly in the 16th century, when European explorers brought the virus to the Americas. The indigenous people, who had no natural immunity to the disease, suffered heavy losses, with more than 90% of the population wiped out. Smallpox quickly spread throughout the Americas, Europe, Africa, and Asia, causing terrible consequences wherever it went. Smallpox is transmitted through direct contact with an infected person or contaminated objects. Typical symptoms include high fever, body aches, and a pustular rash that leaves deep scars on the skin if the patient survives. With a mortality rate of 30 to 50%, smallpox became one of the deadliest pandemics in human history. In the Americas, smallpox contributed greatly to the collapse of the Aztec and Inca civilizations, where populations were severely reduced. In Europe, outbreaks of the disease lasted for centuries, killing millions, disrupting the economy, and undermining faith in government and religion. The impact of the pandemic went beyond the number of casualties and radically changed the social, political, and cultural structures of the affected areas. A major turning point in the fight against smallpox came in 1796, when the English physician Edward Jenner discovered that injecting fluid from cowpox patients could make people immune to smallpox. This discovery laid the foundation for vaccination, one of the greatest medical achievements. Jenner's method was quickly adopted widely, ushering in the era of modern preventive medicine and becoming an important tool in preventing smallpox. In the 19th and 20th centuries, mass vaccination campaigns were carried out, contributing to controlling and reducing the number of cases of the disease. However, the most important victory in the history of medicine came from the campaign to eradicate smallpox initiated by the World Health Organization, WHO, in 1967. The campaign focused on large-scale vaccination and close monitoring. In 1980, WHO officially declared smallpox eradicated, the first pandemic in human history to be completely defeated. The success of smallpox eradication is a valuable lesson in the power of science and global cooperation. It highlights the role of immunization in protecting public health and demonstrates that, when united, humanity can overcome its greatest challenges. Although it is a distant memory, the story of smallpox reminds us of the importance of preparedness and international cooperation in the fight against pandemics. The eradication of smallpox is not only a triumph of medicine, but also an inspiration for future efforts, preparing humanity to face new global health threats. 4. Spanish flu, 1918 to 1919. The deadliest pandemic in modern history. The Spanish flu, which occurred from 1918 to 1919, was one of the most devastating pandemics in modern history, killing between 50 and 100 million people worldwide. With its rapid spread and high mortality rate, the pandemic left a profound mark, changing the way the world deals with global health threats. The pandemic was caused by a highly contagious and particularly deadly strain of influenza A, H1N1. Although it is called the Spanish flu, the disease did not originate in Spain. The name comes from the fact that Spain, a neutral country during World War I, did not censor information, allowing the press to report on the epidemic earlier and more fully. The pandemic first appeared in the United States in March 1918, with cases reported in Kansas. The virus quickly spread to Europe, Asia, Africa, and Latin America through the movement of soldiers during World War I and international trade routes. Within months, the flu had spread across the globe, hitting even remote and less contacted places. What was unique about this flu was that it not only affected children and the elderly, the most vulnerable groups, but also caused high mortality in healthy young people, especially those between the ages of 20 and 40. Symptoms included high fever, body aches, difficulty breathing, and severe pneumonia. In severe cases, people developed acute respiratory failure, which caused the skin to turn blue due to lack of oxygen. The consequences of the epidemic were severe, with an estimated 500 million people, or a third of the world's population at the time, infected. The mortality rate of 2 to 3% brought the death toll to an unprecedented level in modern history. The damage caused by the epidemic went beyond the number of casualties, causing severe disruptions in the global economy, society, and health. Hospitals were overwhelmed, labor resources were reduced, and production and trade activities were disrupted. At that time, medical science was not yet developed enough to determine the exact cause or find effective treatments. Control measures mainly included isolation, wearing masks, closing schools and churches, and banning large gatherings. However, due to a lack of understanding of the virus's transmission mechanism, these measures had limited effect. In many places, governments and people were bewildered by the devastation of the epidemic, leading to chaos and a collapse of confidence in the health system. Although the pandemic ended in 1919 as the virus gradually weakened, the lessons of the Spanish flu have left a lasting mark on the history of global health. The pandemic spurred the development of modern public health systems and highlighted the importance of international surveillance and cooperation in preventing pandemics. It also served as a warning about the risk of global epidemics and the need to invest in scientific and medical research to protect humanity. The Spanish flu was not only a health disaster, but also a milestone in history, changing the way humans view their vulnerability to nature. More than a century later, the lessons of this pandemic remain relevant, especially as the world faces new pandemics like COVID-19. It reminds us of the importance of preparedness and global cooperation in dealing with serious health challenges in the future. 5. HIV/AIDS pandemic, 80s to present. A global crisis. The HIV/AIDS pandemic, which began in the early 80s, is one of the greatest health challenges humanity has ever faced. The HIV virus attacks and weakens the immune system, leaving the body unable to fight infections and cancers. With more than 36 million deaths and tens of millions more living with HIV, the pandemic has not only caused a health disaster, but also had a profound impact on the global economy, society, and culture. The HIV virus is believed to have originated in chimpanzees in Central Africa, infecting humans in the early 20th century. However, it was not until 1981 that doctors in the United States discovered the disease when they recorded rare cases of pneumonia and cancer in gay men. The disease was initially called GRID, gay-related immune deficiency, but was later renamed AIDS, acquired immunodeficiency syndrome, to reflect the true nature of the disease. HIV is spread through three main routes: unsafe sex, contact with infected blood, and from mother to child during pregnancy, childbirth, or breastfeeding. In the early 1980s, ignorance about the disease combined with social stigma caused HIV/AIDS to spread uncontrollably. Homosexual groups, drug users, and sex workers were most affected due to a lack of prevention and treatment measures. By the late 1980s, HIV/AIDS had become a global pandemic, particularly severe in sub-Saharan Africa, which accounted for more than 70% of infections and deaths. The pandemic has killed millions of people of working age, led to a dramatic decline in the workforce, disrupted the economy, and orphaned millions of children. In its early stages, HIV/AIDS was considered a near-death sentence due to the lack of a cure. Patients suffered both physically and mentally, as they were stigmatized and shunned by society. However, in the mid-1990s, a major breakthrough changed the fight against the pandemic: the introduction of antiretroviral therapy, ARV. This therapy controls the replication of the virus in the body, helping to prolong life and improve the quality of life of patients. This is considered a turning point in medicine, bringing hope to millions of people living with HIV worldwide. In addition, educational campaigns on safe sex, condom use, and needle exchange programs have significantly reduced the spread. Since 2000, many international organizations, including the Global Fund to Fight AIDS, Tuberculosis, and Malaria Global Fund, and the Joint United Nations Program on HIV/AIDS, UNAIDS, have launched global campaigns to provide financial support, medicines, and public awareness. Antiretroviral therapy not only helps people living with HIV stay healthy, but also reduces the risk of transmitting the virus. Prevention methods such as pre-exposure prophylaxis, PrEP, and post-exposure prophylaxis, PEP, have become effective tools in preventing HIV infection. In addition, research efforts continue to find a vaccine and a cure for the disease. Despite much progress, the HIV/AIDS pandemic is far from over. Stigma, discrimination, and lack of access to health services remain major barriers in the fight against HIV/AIDS. Countries must continue to raise public awareness, expand access to testing and treatment, and develop policies that support people living with HIV. The story of HIV/AIDS is not only a story of loss and pain, but also a story of hope, innovation, and the human will to overcome adversity. The pandemic has spurred medical advances and international solidarity, providing a powerful lesson about the importance of science and unity in addressing global health challenges. Sixth SARS pandemic, 2002 to 2003. A global infectious disease alarm. The SARS, severe acute respiratory syndrome, pandemic, which broke out from 2002 to 2003, was one of the most serious disease outbreaks of the early 21st century, causing more than 8,000 infections and about 774 deaths in 26 countries. The disease was caused by the SARS-CoV virus, a member of the coronavirus family, and had severe consequences both medically and economically. SARS also became a wake-up call about the potential for pandemics in the context of increasing globalization. SARS was first recorded in Guangdong Province, China, in late 2002. The virus originated from wild animals, of which civets were identified as the intermediate host that transmitted the disease to humans. The trade and consumption of wild animals in wet markets is believed to be the main cause of the virus's emergence. The outbreak began in early 2003 and spread rapidly through international travel routes. Hong Kong became a global epicenter when a patient from China transmitted the virus to international visitors at a hotel. The SARS virus is transmitted through respiratory droplets when an infected person coughs, sneezes, or through close contact. This makes it easy for the virus to spread in crowded environments, such as hospitals, hotels, and airports. SARS causes initial flu-like symptoms, including high fever, headache, body aches, and a dry cough. In severe cases, the disease rapidly progresses to acute pneumonia and respiratory failure, leading to death. SARS is particularly dangerous for the elderly and those with underlying medical conditions, with a mortality rate of up to 10% of all cases. The rapid spread of SARS prompted urgent international action. The World Health Organization, WHO, worked closely with countries to implement disease control measures. These included isolating infected people, monitoring suspected cases, closing borders, restricting international travel, and enforcing strict hygiene standards in hospitals. China, after being criticized for its slow release of information, quickly implemented drastic measures to control the epidemic. Hong Kong, Singapore, and Canada also recorded significant efforts in isolating, treating patients, and protecting health workers. By July 2003, thanks to global cooperation and drastic control measures, the WHO officially declared the SARS epidemic under control. However, the impact of the epidemic went far beyond the statistics of infections and deaths. SARS caused serious economic damage, especially to the tourism, aviation, and international trade industries. Countries such as Hong Kong, China, and Singapore suffered billions of dollars in economic disruption. More importantly, SARS provided valuable lessons on how to prepare for and respond to infectious diseases. The pandemic prompted the establishment of strong public health surveillance systems, increased awareness of hygiene, and disease prevention. Countries also began to place greater emphasis on medical research, vaccine development, and emergency response plans to prevent future epidemics. 7. The Ebola epidemic, 2014 to 2016. A health tragedy in West Africa. From 2014 to 2016, the world witnessed one of the most severe Ebola outbreaks in history, causing more than 28,000 infections and approximately 11,325 deaths in West Africa. The epidemic not only left behind tragic human consequences, but also exposed the weaknesses of the health systems in affected countries and the need for international cooperation in dealing with dangerous infectious diseases. Ebola is an infectious disease caused by the Ebola virus, first discovered in 1976 near the Ebola River in the Democratic Republic of the Congo. The virus is spread through direct contact with the bodily fluids of infected people or animals, including blood, saliva, sweat, and feces. The Ebola outbreak began in Guinea in December 2013, before spreading to Liberia and Sierra Leone, becoming the most severe epidemic ever recorded for the virus. Initial symptoms of Ebola include high fever, headache, muscle pain, vomiting, and diarrhea. In the later stages, patients may suffer from internal and external bleeding, leading to a very high mortality rate of 50 to 90% if not treated promptly. The epidemic spread rapidly in West African regions due to weak health systems, lack of human resources, equipment, and facilities. Furthermore, customs such as direct contact with the dead during funerals significantly increased the spread of the virus. During the outbreak, affected countries faced a serious health crisis. Hospitals were overwhelmed, medical staff lacked protective equipment, and many of them died while treating patients. The high mortality rate and lack of understanding of the disease have caused fear and panic in the community, leading to stigmatization of infected people and their families. In addition, the epidemic has disrupted the economy, causing a decline in agricultural production, trade, and tourism in affected countries. The Ebola outbreak has attracted the attention of the international community. The World Health Organization, WHO, declared a global public health emergency in August 2014, calling for support from countries and non-governmental organizations. Thousands of health workers and experts have been deployed to West Africa to help control the epidemic. Temporary treatment centers have been set up, public education campaigns have been launched, and strict quarantine measures have been implemented to limit the spread. A major breakthrough in the fight against Ebola was the development of the RSV-Zebov vaccine, which was tested during the epidemic and proved highly effective in preventing the virus. The vaccine has become an important tool in preventing future outbreaks. By June 2016, WHO declared the end of the Ebola epidemic in West Africa, although sporadic outbreaks continued in some areas. The Ebola epidemic was not only a health tragedy, but also a warning about the risks of dangerous infectious diseases in a globalized context. It highlighted the importance of investing in health systems, raising public awareness, and strengthening international cooperation to prevent future pandemics. The 2014 to 2016 Ebola epidemic was a valuable lesson in preparedness and response to global health challenges. Although the world has overcome this tragedy, the Ebola story still reminds us of the importance of science, solidarity, and determination in protecting human health from new threats. 8. COVID-19 pandemic, 2019 to present. The greatest challenge of the 21st century. The COVID-19 pandemic, which began in late 2019, has become one of the most serious global health disasters in modern history. With more than 6.9 million deaths and hundreds of millions of infections worldwide as of 2025, the pandemic has not only caused human losses, but also severely disrupted health, economic, and social systems worldwide. The disease is caused by the SARS-CoV-2 virus, which was first reported in Wuhan, China, in December 2019. SARS-CoV-2 belongs to the coronavirus family and is believed to have originated in animals, spreading to humans through a seafood market in Wuhan. COVID-19 is spread through respiratory droplets when an infected person coughs, sneezes, or talks, as well as through direct contact with contaminated surfaces. The virus is highly contagious, even during the incubation period, making it extremely difficult to control the epidemic. The symptoms of the disease are very diverse, ranging from mild symptoms such as fever, cough, loss of smell and taste, to severe symptoms such as difficulty breathing, acute pneumonia, and multiple organ failure. The disease is especially dangerous for the elderly and those with underlying medical conditions. The COVID-19 epidemic broke out strongly and quickly spread globally in just the first few months of 2020, forcing the World Health Organization, WHO, to declare a global health emergency on January 30th, 2020, and then a pandemic on March 11th, 2020. Countries have adopted many strong measures to prevent the epidemic, including lockdowns, social distancing, school and workplace closures, international travel restrictions, and mandatory mask wearing. However, these measures have also had a major impact on economic and social life, with many industries, especially tourism and aviation, severely affected. The pandemic has also spurred an unprecedented race in medical research. In less than a year, COVID-19 vaccines have been developed and approved for emergency use, a remarkable medical achievement in history. Vaccines such as Pfizer-BioNTech, Moderna, AstraZeneca, and Sinopharm have been deployed globally, significantly reducing the number of deaths and limiting the spread of the virus. At the same time, new treatments such as monoclonal antibodies and antiviral drugs have also been developed to improve the survival chances of COVID-19 patients. While vaccines have helped to control the pandemic to some extent, the emergence of virus variants such as Delta and Omicron has further complicated the fight against COVID-19. These variants are more transmissible and partially resistant to vaccines, forcing countries to constantly adjust their response strategies. The pandemic has not only had severe health consequences, but also caused profound economic and social crises. Many businesses have gone bankrupt, millions of people have lost their jobs, and disruptions to global supply chains have slowed economic recovery in many regions. Socially, the pandemic has also increased inequality, especially in access to vaccines between rich and poor countries. The COVID-19 pandemic is not only a health disaster, but also a major test of global solidarity and cooperation. It highlights the importance of investing in public health, scientific research, and building effective emergency response systems. At the same time, it is a reminder that only international cooperation and fair sharing of resources can help humanity overcome such major challenges. Although the world has made great progress in controlling COVID-19, the pandemic remains a looming threat. The lessons of COVID-19 have reshaped how we think about health, science, and how we respond to future global crises. The story of COVID-19 is not only a story of loss and grief, but also a symbol of the power of human will, science, and international solidarity. Historical pandemics have been more than just health disasters. They have also been reminders of our vulnerability to nature. From the Spanish flu to HIV/AIDS to COVID-19, each pandemic has highlighted the importance of science, international cooperation, and preparedness. They have spurred medical advances, improved health systems, and raised public awareness. Looking ahead, investing in public health, developing vaccines, and building early warning systems will be key to tackling new health threats. Pandemics are not just challenges, they are opportunities for humanity to come together and strengthen our ability to protect life.